All right, let's dive into a topic that can feel, well, a little intimidating. Pediatric central nervous system disorders. Now, that sounds like a mouthful, I know, but we're going to break it all down today by thinking about it in a completely new way. So let's get right to it.
So for this entire explainer, I want you to just hang on to one big idea. The central nervous system, the CNS, it's like the body's main command center. It's a supercomputer, and when something goes wrong, it's basically like a glitch in the system. Honestly, that one single idea is going to help us make sense of everything else we talk about.
So here's our game plan. First, we'll get to know the command center itself. Then we'll dig into what happens with software glitches and hardware faults. After that, we'll peek inside the toolbox to see how technicians find the problem. And finally, we'll look at how the entire support team comes together to help.
Okay, first stop, the body's command center. The CNS is the absolute master controller of, well, everything. We're talking about a child's first steps, their first words, their ability to learn new things, to feel emotions, even to dream. It's the brain and the spinal cord working together as this incredible central hub.
You know, it's really important to get this up front. The lines we often draw between neurological disorders and mental health disorders can be, frankly, pretty artificial. Because the brain is in charge of the whole show, a condition that affects how a child moves can also impact their mood, and something that affects learning might have physical roots. It's all connected.
So if the CNS is our command center, what happens when its programming, its software, doesn't quite develop the way we expect? Well, that brings us right into the world of developmental and communication disorders.
A perfect example of this is cerebral palsy, or CP. Now, here's the thing you've got to remember about CP. It's not a problem with the muscles themselves. The issue actually starts in the brain, in the command center, and that's what affects how the body moves. In fact, it's the single most common cause of motor impairment for kids.
And CP isn't just one single thing. It gets broken down by the type of movement problem. The vast majority, about 80% of cases, are spastic, which means the muscles are really stiff. But you also have dyskinetic, which involves more uncontrolled movements, and ataxic, which messes with balance and coordination. And sometimes you see a mix of these. And of course, CP isn't the only software issue out there. We also have conditions like autism spectrum disorder, which can really affect social communication, and ADHD, which impacts things like focus and activity levels. And it's actually not that unusual for these things to show up together, which just goes to show you how linked all the brain's programs really are.
Okay, let's switch gears a bit. We've talked about the software, so now let's talk about the hardware. In this next section, we're going to look at problems that are more like electrical surges or even physical issues with the command center structure.
Now this is a question I hear all the time, and for good reason. The words all get thrown around, and it can be super confusing. So, let's use our command center analogy to clear this up once and for all.
Okay, so a seizure is the event. It's the thing that happens. Picture it like a sudden, totally uncontrolled electrical surge inside the brain. It's a temporary malfunction in the command center's wiring that just throws everything off for a little while.
Epilepsy, though, that's different. That's the underlying condition. It means the brain's wiring is just more likely to have those surges. So a person doesn't have epilepsy just during a seizure. They have a condition called epilepsy, which is what causes the seizures to happen.
And here's something that can be really reassuring for parents. Not every seizure means a person has epilepsy. About 3% of young kids will have what's called a febrile seizure, one that's brought on by a high fever. And for most of them, it's a one-time thing that doesn't cause any long-term problems.
Another really common system alert is a headache, but they come in two main flavors. A primary headache, like a migraine, well, that is the problem. But a secondary headache is actually a symptom of something else going on, like an infection or another issue. And there are clues, like the pain getting worse when a child lies down, that help doctors figure out which is which.
And one more structural or hardware issue is something called hydrocephalus. The easiest way to think about this is like a plumbing problem. See, the brain is protected by this fluid that's always circulating. But if one of the drains gets blocked, that fluid starts to build up, and that creates really dangerous pressure. It's literally a drainage failure inside the command center.
So, with all these possible software glitches and hardware faults, how in the world do doctors figure out what's really going on? That brings us to our fourth section. We're going to look at the diagnostic toolkit that these system technicians use to pinpoint the problem.
You know, this process is really methodical. It's definitely not guesswork. It all starts with a super detailed history and a physical exam. From there, they might move on to things like brain imaging to actually get a picture of the brain, or neurophysiology to check the electrical wiring, or even super specialized tests to look for genetic or metabolic clues.
And when we talk about imaging, it's all about picking the right tool for the job. An MRI gives this incredibly detailed picture of the brain structure. A CT scan, on the other hand, is much faster, so it's great in an emergency when you're looking for bleeding or a fracture. And for the tiniest patients, newborns, a cranial ultrasound is a really safe and effective way to check for certain issues.
Okay, so once a diagnosis is finally made, what happens then? Well, this brings us to our final and honestly most hopeful part. The multidisciplinary response. In other words, the full repair and support team that gets brought in.
And this part is just so critical. It's not one person who handles these complex conditions. No way. It's a huge team effort. You've got the medical experts, pediatricians, neurologists, but you also have therapists who work on movement, on daily skills, on speech, plus psychologists and social workers who support the child and their family. It really does take a village.
And that really brings us to the most important point of all. The goal isn't always finding a cure. For a lot of these lifelong conditions, the focus really shifts to managing the system, to adapting to the glitches. It's all about providing every possible tool and all the support a child needs to reach their absolute fullest potential and to live the best, happiest life they can.
Which kind of leaves us with one final thought to chew on. We are learning more about the brain, this incredible, unbelievable command center, every single day. So the question for all of us really becomes, how do we take all that amazing new knowledge and use it to build better therapies, better diagnostic tools, and better support systems for the next generation of kids who need it? That is the challenge and the opportunity right in front of us.